So what I'll get you to do is, so you sit at the end of the bed and then hold one knee and then you lie down, okay? So just wait a second, just at the end of the bed. So bring, no, not all the way, at the edge, on the edge of the bed. Bring one knee up, good, with both legs, and then you can lie down on the pillow, okay? All right, so all the way, good. All right, so what we're seeing here, guys, we're seeing that he's not too bad. I mean, you know, if the people can touch the bed with the thigh, I would say it's okay. Yeah. But if the thigh is hanging up there, then we know the hip flexors are a bit tight. Now, but I think what else is got tight? Yeah, but rectus femoris is a bit tight. So you hold that. So if I did that, you feel a lot of tension through here, don't you? Yeah. Okay. But in terms of ITB is okay, so it's fairly much quite straight because it was a lot of abduction, maybe also ITB is a bit tight. So let's change the legs, hold that. Okay, but this one is a bit different. So you've got a bit of hip flexor tightness, ITB, and also rec as well, yeah? So, and he might not be able then, you know, so if you do that, so he still comes like that. Yeah. Okay, so we're building a picture. I'm just looking what, you know, if it's tight or that's wrong. Thank you, okay. Now, other things, what we could do, come on the bed a bit more. Come on the bed. Now, also want to have a look at the glutes, for example. But some days I cannot assess the glutes if it's too tight. We might need to do some soft tissue work before we can assess the glutes. There's a variety of ways of assessing glutes. I tend to assess in a different position. I'll show which way I do it. But in terms of the muscles, I tend to talk about hip extensors, hip abductors, not glute max, glute med, because it seems to, with hip extension, we activate lots of muscles, not one muscle. Yeah. So just keep it hip extensors, hip abductors. I think that's more correct term. So get your bend your both knees for me. Good. Just yeah, like this. Now, and can you just do a bridge for me? Just simple bridge. Good, and then down. Okay, just a couple times. You can see that I've put a bit more still rotated here. Yeah. So what do you feel when you do this? What do you feel that's working? So keep going and just tell me what do you feel is working?
The hamstring.
Do you feel anything in the glutes or more hamstring?
More hamstring.
Okay, good. So it's good to know. I asked them, where do you feel? Because I kind of want them, if I want the glutes to work, I want them to feel a bit in the glute, huh? Not in a hamstring. Okay, so we can challenge you a little bit. So what I get you to do, bring this knee towards your chest and hug your knee. When you do that, what happens? You go into a bit more posterior tilt. Now the other things what I do, so get the patient to bring the heel towards your butt, a bit more closer. That's it, as much as you can, good. Now keep the foot flat, yeah, so don't try to come on the toe, just keep it flat. Now keep this, and then slightly, so when I put the heel towards the butt, you're trying to eliminate hamstring a bit more. When you ask him to push into me, we also then trying to avoid too much adductors working. So from that position, okay, push into me a little bit, yeah. Keep the foot flat, and now lift your bottom up. Okay, and down, but yeah, okay. Keep it flat. Wait a second, yeah. So keep it there and push into me a bit more. Keep it coming up and down. Keep breathing, don't hold your breath.
Fairly good.
Down and keep breathing. How difficult is it? It's not that easy, is it? How do you find this?
It's hard.
It's not easy, huh?
Yeah.
Okay. So for athletes or for people you know who supposed to be a bit stronger, you want them to do around 10. If some people they cannot do 1, they drop, they flop. So let's go to the other side a bit more. So bend the knee, good. Bring the heel towards you a bit more. Just wait a bit more. Oh, that's it. Yeah. Keep your foot. Yeah. Okay. Maintain or push your knee into me a bit more, and let's go now.
I don't think it's possible.
Push.
It's not possible.
And yeah, so he's using a bit of back muscles, yeah? So why we're doing this? To show to the patient where they feel a bit more in control, where it's a bit more difficult. And then we're gonna put all this together because it might be, if you don't have glute endurance, you're probably going to be maybe overloading the lumbar spine as well. So you kind of want to have a look at that. So hip flexors, glutes a bit. You can look at hip abductors as well. So lie on the side, face that way for me. Good. Now bring this knee towards you a bit more. Again, if it's hip flexor is tight, I might not even get you neutral, but I get you to just keep your knee straight. Now roll your pelvis forward a bit more. Just roll your back a little forward. And can you, with your leg, reach out for me? Reach out towards the ceiling. Reach out. Okay, reach out. Hold that. Okay, hold that. Reach out. Hold that. So inner range glutes probably not the best. So again, so reach with the foot towards the toilet. Reach out. Hold that. Okay. Now what I want you to do, maintain that position. Get you to drop the leg, come back up to the, keep the knee straight. Keep the knee straight. And again, drop and come up in that position. Let's go 10 times. 1, 2, keep straight. Can you feel what's happening with the glute? A bit, the glute is thinking, what is happening with me? What is happening with me? And do you think it's easy for him? Is it easy for you? Okay, so we want to do 10 times, good control with that. And again, so hip abductors are quite important also, lumbar pelvic stabilizing muscles. You can also hold that, reach out, maintain, hold that, and you can see that, so I can really easily break him as well. So definitely the hip abductors also has to do a bit of work. Okay, and the same on the other side, you can have a look as well.
So you give traction or you just ask them to point?
I'm giving him, so what I don't want to do, the reason why I did this, again, maybe we just need to watch it good, and just kind of just like it. The reason why I asked him to reach out, I don't want a lot of QL. By reaching out, you lengthen your lumbar, so you're not kind of overcompensating by, yeah, so that's the reason. So, okay, just relax a bit more first. So roll your pelvis forward a bit more, good. Now again, so you can reach out, like again, like to the door, reach out, and then you can ask him if he can hold that. So I'm looking that, reach out and hold that. Looking at that inner range control of the hip abductors, okay? So the neck, stay there, drop, relax now, relax, good, relax, coming up and that way. But again, make sure the knee is straight and keep that way, okay? So coming up, so 10 times, looking at the quality as well. 1, relax your head, keep breathing. Relax your head, keep breathing. Okay, good. Just soften through here, just relax through here, and just think about this. Relax through here, think about this. And he looks buffed, huh? But the legs. And it's interesting, isn't it? The guys like to work, and then the legs. No, he doesn't have like that. But you know what I mean? But with all due, I remember when I was younger, I used to go to the gym more often. But my legs always were skinny. Like, I don't know, I used to like to be more upper body. I hate legs. And I mean, lots of guys tend to hate doing legs. Do you guys like doing legs? More upper body. Or maybe it's changing, I don't know. But like the girls used to like to do more legs, less upper body. The guys opposite, typically. But, so that's interesting. So you can see, and yeah, so I think, to be honest, if you really fire your legs in the different exercises and think about softening your back, because I don't know, but I think your strategies and why you get this spasm in your glutes, because doesn't have enough endurance. And that's why you feel this spasm, because maybe works extra hard, so it gives you that sensation of spasm. But also what I think, I don't know, like what you do, you can have a look. You said that rotational exercise gives you a bit of maybe thoracic pain as well. So it would be interesting how he does. And I don't want to give him too much away because he's smart. Physio, he will change it. So we'll see how he does it and if we can modify some things. So do you guys have any question with that? Okay, so what I would like to do in each other, do Thomas test. do the bridge, double bridge, see where you feel, and then try to challenge each other single leg bridge a little bit, and then hip abductors as well. Have a look at those options.